All right. Good morning, everybody. It's me, Dr. William Hatten, and I am here with our star patient of the month, Miss Stephanie. And let's get right into it, Miss Stephanie. What brought you to my office?
Well, I was involved in a car accident.
Oh, I'm so sorry.
Yeah. So,
Can you tell me a little bit more about the car accident? What was the nature of your injuries?
well, I was hit from behind by
Uh-huh.
two cars.
Oh,
I was at a complete stop, actually turning into my driveway.
oh,
And the car behind me had stopped, but the car behind him did not,
right.
and forced him, the second car, into me. So I was hit basically from behind by two vehicles.
I'm so sorry to hear that.
Yeah.
I know a lot of common things that happen when people are in similar types of accidents are, they suffer from neck pain and back pain and headaches. Have you dealt with anything like that over the course of your recovery?
Absolutely. I mean, it pretty much started immediately.
Okay.
I could tell that night that my neck had been,
Damaged.
yes.
Yeah.
And then especially the next morning kind of felt like, oh, I was in an accident.
Right. Was it
Yeah.
hard to move, or kind of what were you experiencing?
Yeah, I mean, I don't know if you remember when I first started coming in, I could barely turn my neck.
Right.
I mean, it was, like even to drive, and I mean,
Right.
obviously I was a little more tense driving after that, but to like turn to make sure that
Right.
nobody, it was
Right,
it
the
was very
anxiety and
painful.
the PTSD of that moment.
Oh,
On top of
absolutely.
now, like the functional impairment, right?
Yeah.
And that's a really, really common thing that we see in car accidents. And I like to think I'm pretty good at taking care of car accident patients. And that will lead us into our next question. What has your experience been like here in the office?
It's been tremendous. I mean, I had a feeling the minute I walked in and met you
Aw.
that this was going to be a good fit.
Yeah, and what kind of things have we been doing to help you?
Well, you've been just adjusting me. I come twice a week.
Yeah.
You intuitively, I believe, know what to do. I mean, you know at my neck and my lower back.
Right.
But you just, you're good at what you do. So your intuition guides you to what I need.
Yes.
And it's been extremely helpful.
Well, thank you so much.
Absolutely.
And we do work with a team of professionals. So Ms. Stephanie mentioned that she was referred here by an attorney. And then I have a large network of imaging specialists, like for an MRI or a CT, as well as neurologists, orthopedists, physical therapists, even other chiropractors that might do something that I don't, as well as mental therapists, so for that PTSD that we were talking about. So I know we've connected you to several other providers and have allowed you to have even more care and more access to care than what I can provide, because I really believe that teamwork and having more people helping you out is ultimately going to result in better care for you, better outcomes.
Absolutely.
Have there been any surprises with your care here in the office?
Well, surprises, I don't know if I would say surprise. You did refer me to get an MRI.
Yes.
And that was a surprise, but it was also a good surprise because it validated
Right.
what I was feeling.
Right.
So I didn't feel crazy.
Right. And that was a really interesting experience. I would love to share a little bit about that with our audience today. The medical doctor that you saw that reviewed your MRI at the orthopedic office had maybe a slightly different interpretation of the MRI results than I did.
Yes.
Would you like to share any thoughts on that?
Well, yeah, it was kind of frightening, actually. I mean, I felt like he was portraying my situation to be like potentially needing surgery.
Mm-hmm.
And I don't believe in that unless absolutely necessary.
Right.
I'd much rather try the holistic approach.
Right.
And I have had great relief since coming to see you.
Wonderful.
I mean, I'm a work in progress.
Sure,
but-
aren't we all? Oh my gosh.
Yes, but it's been wonderful.
For sure.
Yeah.
And I highlighted this because a lot of people don't take into account that a medical doctor, especially a surgeon, when you think about what service it is that they provide and what service it is that they sell surgeries, right? Perhaps they'll prescribe an antibiotic or a steroid or some kind of anti-inflammatory medication. But a surgeon is there to perform surgeries, and chiropractors are here to do adjustments. And when you think about the type of injury or the type of damage that you've sustained, when you seek out a care provider, no matter who it is, they're going to offer you what it is that they do. And so when you see an orthopedist, they're going to look at an MRI report and they're going to say, this looks pretty serious. It might need surgery. And for a patient, that can be really intimidating and really frightening. And it might not be that they must have surgery, but that is what that provider sells for
Right.
that problem, right?
Correct.
And so one of the things that we did was look at the MRI reports together, go over all of the findings. So she was very clear on the nature of her injury, but I have 6 years of experience in personal injury, and I can say with the hundreds, thousands of patients I've seen that have these symptoms, in fact, not all of them did need surgery. So you are the chief steward of your body, and you are in charge of what happens to it, at least in terms of electing to have a surgical procedure or not. And you ultimately will know when it's time to get surgery and when it isn't. And so I somewhat took issue to the surgeon trying to push a surgery on Stephanie. So I wanted to make sure that she had a complimentary opinion on that.
Yeah, because when he said extreme, mild extreme, and had me here, it didn't settle right.
Right. Yeah.
Because I have had progress
Right.
in my care here.
Right.
So I'd much rather personally continue down
Right.
that lane.
Right.
Yes.
And then another question I like to ask people, and I hope I know the answer to this one, but would you be willing to recommend me to your friends or family? And if you did, what would you say?
Oh, 1,000% I would, yes.
Well, thank you so much.
And I would just tell them about you.
Yeah.
It's just like your love and light and, your knowledge, your professionalism. It's just been very refreshing.
Oh, thank you so much.
Not
I
all
really-
chiropractors are the same, and I do believe in chiropractic care.
Yes.
I've been away from it for a couple of years, so when I was told that this was where I was being referred, I was somewhat skeptical, but like I said, you had me at hello.
Aw. Well, thank you so much. Is there anything else you'd like to share with our audience today before we let you go?
Well, I just believe every cloud has a silver lining. And of course, nobody wants to get into a car accident. But if I had to get into a car accident, I feel like being able to come here, which is something I genuinely look forward to, has been my silver lining.
Aw.
And my boyfriend, the roller bed.
Yeah. I am really glad we could facilitate that connection with your new romantic partner, the massaging traction table in the therapy room. That's been really wonderful. Well, thank you so much for your time today,
Absolutely.
Stephanie. I really, really value the opportunity to take care of you, and I'm so grateful that you've come to my office so I can help you recover.
It's a privilege. Thank you.
Yeah, thank you so much. And everybody, make sure you stay tuned. We're going to continue doing the star patient interviews once a month like we started last year. If you're interested in becoming a star patient, you can always head to my website, www.drwilliamhatton.com, where you can schedule your own appointment and then just chat with myself or Joseph. We'd love to get you interviewed, and we'd love to get you into our campaign. Thanks so much, and talk soon.